a ultrasound assessment, and we're looking at where the transverse abdominis comes in and starts to aponeurose with the rectus abdominis, and we've got the oblique layers over top.
So one more time, show me the trend.
So here's the rectus abdominis
Beautiful.
coming in and meeting the fascial attachment where it meets the oblique muscles and the transversus abdominis.
Yep.
And then the transversus abdominis, the ones we're always trying to help our patients learn to wake up.
Right.
So
Without bulking.
all of these muscles are a bunch of different motor units.
Mm-hmm.
And in order for a muscle to contract, it has to have something to pull on to get its strength. If one end is floppy and it goes to contract, it doesn't have the same power and we get bunching. And so rather than just telling the patient, you need to strengthen this muscle, we need to do something to help the body heal these attachments to allow more normal mechanical activation patterns for the muscle using some of the regenerative treatments that we do.
So show me with the ultrasound how you facilitate that one little piece.
Being said, if we're following this muscle here,
Okay, hold
and
on.
we're looking at the transversus abdominis level,
Uh-huh.
and I can use the pointer here,
Okay.
and then we'll cue our patient to do a contraction and contract. And we see as that muscle activates, it pulls and balls up over here. But again, it's not significantly abnormal. If we go back in that same area, and we're at the same location now, but I'm thinking that these attachments between the muscles have very mild fraying and inflammation in there, that being the black thickening of that area. And we're at that same spot. And now I'm just using my finger to place it over top of it to allow almost like a different fulcrum to pull on. And then we do it again.
Contract.
Now when we go to contract, we don't see it sliding back as much because it's got some extra support there.
Perfect.
Sure.
So I'm looking at you facilitating.
All right, so just putting my finger over top of it.
Uh-huh.
And now let's do that same contraction. And when you go to do it this time, we get the same contraction, but the muscle doesn't pull back as much.
Can you do a small pelvic floor contraction? Just a little, ooh, wow.
And
that's
we
a
see that
big
muscle
one.
engage.
Yeah, good. And let go.
And what we see here is that with a lot of patients, as this connection gets frayed, the muscle doesn't have the anchor point to have the mechanical advantage to contract, and so it doesn't have that same tensile strength that it balls up. And that goes both on the anterior aspect where it makes rectus abdominis, as well as if we scan it all the way back here to where it meets the thoracolumbar fascia, that's another point where things can get frayed.